Hello, and welcome to AFSPA Live, our monthly digital broadcast designed to give AFSPA members and eligible federal employees a place to ask questions and get answers about past AFSPA Talks topics, their benefits, and wellness needs. There are three primary ways you can join our broadcast. Join us live by clicking the link in this video description and following the instructions to allow access to your camera and microphone. Then, a show moderator will be available to assist you further. You can ask your question through the chat box on whichever social media platform you're streaming AFSPA Live, YouTube, Facebook, or LinkedIn. If you're not able to join us live, call our toll-free line prior to the broadcast at 888-435-0757 and leave our team a voice message that we may play back and answer live on air. Just tell us who you are and the question you'd like us to answer. I'll see you at the next AFSPA Live.
Hi, everyone. Welcome to AFSPA Live. Yeah, my mic was muted. I'm Maddie Norton. I'm Communication Coordinator at AFSPA. AFSPA Live is the live Q&A session that we host every Thursday or every last Thursday of the month at 11 a.m. Eastern. And today we will be discussing the Medicare prescription drug plan. We have our COO, Kyle Longton, with us as usual. And our special guest today is TJ from Express Scripts. So we have a live expert with us, and we are ready to dive into this topic. I know that we wanted to hit on a few just basic FAQ questions, and because we know that those are some of the most asked ones, and want to get those answered before we dive into very detailed questions.
Excellent. And I just want to say, TJ, thank you for being here. We are looking forward to this discussion. We're probably going to go about an hour today, using the first half hour to address the Medicare PDP questions that we may have, and then use the second half hour to look at some of the more general open season questions that may come about. But Maddie, I agree with you. Let's get started with some of those general questions that we've been hearing a lot from members in person, at webinars, via the dozen emails I answered this morning. So bring them on.
All right. So I'll start with the most common question we have is, are you automatically enrolled into this plan?
Well, thank you guys for having me here, first of all. And to answer that question, yes, enrollment will be automatic for everyone who is eligible to be enrolled in the Medicare PDP plan through Express Scripts. So there's nothing that members need to do. If you meet the eligibility requirements, AFSPA is automatically enrolling them in the plan. All
right. And then our next most asked question is, how do you opt out, and how do I get confirmation that I opt out?
And this one's on me. You can opt out in really two main ways. One is by going to afspa.org/PDP, like prescription drug plan. And there is a form on that page. It's very simple. You enter your information, including your FSBP ID number, your name, and there's a drop-down menu about what action you want to take. And the first one on there right now is to opt out. You do that, you submit it, and then you should receive an email that confirms that you've opted out. Now, the language on the confirmation email that's been going out has been a little confusing to people. It says, it includes at the top a confirmation number that is 9 digits, a dash, and then 7 digits. It then says something about your 2024 benefits, and then it will say Medicare prescription drug plan. And then the part that people have found confusing is that it says waived opt out. And people have been taking that to mean, oh, I've waived my opt out. No, that's not what I meant to do. It's basically double confirmation there. You've waived your coverage in the PDP, and you've opted out of coverage in the PDP. So please, if you receive that email, we got a lot of questions about that. If you receive that email, that is your confirmation that we have received your opt out and it has been processed. So you can absolutely go to afspa.org/PDP, complete that form, and you should get that email. The other option, if you don't want to do that, is that you can give us a call at the AFSPA office, 202-833-4910, and either leave a message for or speak to someone in our member quality services area. and they'll make sure that the opt-out is processed.
All right. Our next question obviously is, can I opt in at any time in the future? And will there be a penalty for that?
Well, I can answer this one. And yes, members are able to opt in at any time. AFSPA is given a lot of flexibility with the new Express Scripts PDP plan. So if a member just chooses to opt out initially and 6 months down the road, they like to opt in, they certainly can do that. And they can do that by contacting the AFSPA office at the number that Kyle provided just a minute ago.
All right. And I know that a lot of questions have started coming in about the high income category, or also known as IRMA. So what is the high income category, and what salary does it start at, / how does that all work in the grand scheme of things?
Sure.
So yes, I can take the first part of this, Kyle. So that high income category you're referring to is called the Medicare Part D, as in drug, income related Medicare adjustment amount, also referred to the acronym DIRMA. And what it does is it's kind of a penalty for high income earners. And it doesn't go by just your salary. It goes by your adjustable gross income on your tax returns. So in the year 2024, an individual tax filer, anyone who has a adjusted gross income of $103,000 or more, they would be subject to that DIRMA penalty. I think we do have a slide that we can show everyone that has the dollar amounts. So thank you. So as you look at this chart here on the screen, you can see if you make an adjusted gross income of $103,000 or below, and you're an individual tax filer, you only pay your premium. That's it. So as you can see in the next category, $103,001 to $129,000, you would pay your premium plus an additional $12.90 a month. I'm not going to go through each of those. I'm sure if we can get this posted somewhere, provided so people can have this, I think that'd be great. But as you can see, if you have an adjustable gross income of over $500,000 a year, you would just pay your premium up to and 81 additional dollars. I will add this piece is that for the benefit that you're getting, even if you were one of those high income earners making $500,000 of an adjustable gross income, the benefits still by far exceeds the additional $81 that you would pay for your premium. So great question.
And I just want to add, because we've gotten this question several times, that there is no, as noted, there's no premium, there's no separate premium for the PDP program. So anybody making $103,000 or below, or $206,000 for those married and filing jointly, below that, it's this program we are offering as part of your FSBP benefits. So there's no additional premium. It's only if you hit those income thresholds that you may face the IRMA payments that we just saw on the chart. And this is only for those who will be enrolled in the Part D.
Yeah, and just to add a little more color to this, Kyle, because you're correct. There is a lot of questions coming around this. And as it relates to the DIRMA penalty, it's something that is strictly handled through the Social Security Administration. AFSPA, they have no bearing into it because they don't know what someone's adjustable gross income would be. Express Scripts has no visibility into it. It's something strictly from CMS, which is Center for Medicare and Medicaid Services, and the Social Security Administration. So they look at your individual tax returns from 2 years prior, and then they see your adjustable gross income. And if it falls in one of those ranges, then that's how they assess the penalty. How you would pay that if you happen to be one of those high income earners is you would receive a letter from the Social Security Administration notifying you that you are a high income earner and how much that penalty would be. Based upon your Social Security check, if you have enough in it to cover that additional amount, it will be automatically drafted out of that. In the event that you don't have enough in your Social Security check, or you would just like a direct bill, then the Social Security Administration would send you a bill and you would pay it in that manner. But I think it is a good point to highlight that AFSPA, as well as Express Scripts, has no visibility into members who will have that DIRMA penalty.
All right. And it looks like we are getting a lot of questions in our YouTube chat. So I'll try to go over some of those. I've seen some ask about where can I fill prescriptions with this new plan? It looks like people are asking about Harris Teeter, some other places. If TJ, you'd like to answer that.
Absolutely. So in this Medicare network, there's over 60,000 retail pharmacies in this network. That's a lot of pharmacies. So all of the national chains, Walgreens, CVS, Walmart, local independent pharmacies, you can still order through Express Scripts home delivery, Credo. All those pharmacies are in the network. The only pharmacy that isn't is the Kroger family chains of network pharmacies. They are excluded just as they are today. So those would not be under the Medicare network as well.
All right. And
I'm sorry, I just want to note that folks can go to that AFSPA.org/PDP page, and on the right-hand side, there's an option to click on FSBP-Express Scripts Medicare Prescription Drug Plan, and that will take you to a dedicated Express Scripts site where you can do a search for pharmacy, as well as a search for pricing drugs under the PDP plan. So you can get that information, find a pharmacy, all on that website.
all right. And it looks like we're getting a lot of questions about if they have Part A or Part B of Medicare, how does that affect them with this new PDP plan?
Okay. So Medicare Part A, in order to be eligible for the Medicare PDP, you need to be retired at least age 65 and has Medicare Parts A and or Part B as in boy. The key word there is or as it relates to Medicare Part B. That is optional, and it's not an eligibility requirement to be in the Medicare PDP.
All right. So you don't have to have both. You can have either or. And I think that's a question that we've gotten a lot. So the answer is you don't have to have both. You can have one or the other.
And I'll just note that opting out of the Medicare Part D is in drug plan, the PDP that we're offering, will in no way affect your enrollment in Medicare A or B. It's not related. We're just handling the PDP information. So if you opt out, you're only opting out of the PDP. Enrollment in Part A and Part B is still handled directly through Medicare.
All right. And I know that we've gotten some questions about, especially since a lot of our members are overseas. We have a question from YouTube where someone has said, if I travel overseas and get sick or injured, will this new plan cover us there?
Great question. So medications are covered overseas. They're covered in emergency situations. So coverage outside of the United States is only covered for emergency situations. So one thing I would like to call out is the drug that you receive while overseas or traveling abroad, it must have an American equivalent NDC number, which stands for National Drug Code, in order for that drug to be covered. So the member would pay for it out of pocket while they're abroad. Then they would submit a paper claim to Express Scripts and get reimbursed for that drug.
And I just want to take this opportunity to clarify that the PDP, it only affects the prescription coverage. All of your other coverage under Foreign Service Benefit Plan, the hospital, surgery, medical, all of that remains the same. This only is meant as an enhancement to the prescription drug coverage. So if you're overseas and you go and you need medical care and you see a doctor, you're in the hospital, anything like that, those benefits are not changing. And we're not making major changes anyway into 2024. So it's just the prescription drug plan.
All right. And I know that we have also had a lot of questions about people who have the Medicare Advantage plan. If they have that plan, does that affect them being eligible for the PDP plan at all, or how does that work?
So if they have the Medicare Advantage plan today, they would not be automatically enrolled in the Medicare PDP through Express Scripts. Now, in the event they would like to move from the Medicare Advantage to the PDP, that will be a conversation they can contact the AFSPA offices and speak to someone there about that process, if that is something they would like to explore.
All right.
Right. And I'll just add, if you're in the Medicare Advantage plan, you want to keep that next year, you don't have to do anything. You are already enrolled in a separate Part D plan as part of that Medicare Advantage. That Part D plan is administered by CVS. So, but if you want to make a change back to typical FSBP high option benefits with this PDP plan, there's a couple steps you'll have to take. One is contacting the Aetna Retiree Center to get out of the Medicare Advantage plan, and then you'll come back to us and we'll handle things with the PDP from there.
All right. I know that we have gotten a lot of questions about why OPM allowed us to have this plan now, or like why this is something that we've decided to include as FSBP. So Kyle, if you'd like to touch on that. I know we have a question from Bob about what is the business case made to add the new plan.
Sure. Okay. So, and we covered this some in the previous podcast back in October 30th and the webinar somewhat on October 31st, but happy to talk about this again. So essentially, yes, the Medicare Part D plans have been around since 2006. And honestly, federal plans would have welcomed being able to participate in them prior to now. Because there are savings involved. OPM has looked at the savings. The Inflation Reduction Act that was passed now has also opened up the opportunity for Medicare to negotiate prices on certain drugs. It's a small number to start with, certain drugs going forward. We may not see that come to fruition for another couple of years, but OPM sees the option and the savings that can benefit the entire program and plans individually. So plans had the option to go this route in 2024 for the first time. FSBP decided to do so for a number of reasons. One, the savings, and that is the main reason. The savings for individuals. We've structured the benefits, and I think we have the cost sharing slide that we can share. But we've structured the benefits so that members can save, as TJ mentioned before, significant amounts of money on their out-of-pocket costs. And this is across the board, whether generic, preferred, non-preferred, and any level of specialty medication. The savings are significant. These are savings out of your pocket. This is what members pay. There's also savings for the Foreign Service Benefit Plan in enrolling in taking advantage of this opportunity. And so I share that because those savings come back to the plan in full. And those savings we pass along in the form of not increasing premiums so much in future years. Our premium increase going into 2024 is 5.5%. It's higher than any of us would like, myself included, but it's only 5.5%. The program-wide average is 7.7%. I've seen some plans over 10% with their increases. This helps us control our costs overall for years to come, while also providing savings to individual members. It is a win-win situation.
All right. And it looks like we have a question about, please clarify what is an emergency overseas. Would I be covered if I'm overseas and need to fill a prescription? I know we discussed that, but whether I live or travel overseas, it seems they're asking.
No, great question. So an emergency is anything ranging from losing your medication, forgetting your medication, just getting sick while traveling abroad and needing a medication. That's an emergency. CMS's major point is to make sure members have access to care. So there's not going to be any type of investigation or looked into when someone says they have an emergency. If a member says they were traveling and had an emergency, then that medication is going to be covered.
All right. And I know that we've had a lot of questions about current prescriptions that members have, and there's been questions especially about prior approvals. So will my RX or prior approval change in the new system? Is the prior approval I have through October 2024, this member asked, still good, or do I need a new prior approval?
No, another great question. So as it relates to prior authorizations, prior approvals, those will transfer from the account they have today to their Medicare PDP account, as long as it's active. Anything that is expired, they would have to go through the process again with their physician, just as they would today if they remained in the FEHB plan they are in today. But those prior authorizations they have will transfer automatically. Nothing a member needs to do. So to the question and point, the October 2024 one will still be valid until October of 2024.
Perfect. Kyle, I think you can answer this question possibly. We've had people ask about TriCare, if they have TriCare. So someone has asked, I would like to know how this new program will work with TriCare, especially TriCare for Life.
Sure. That's a great question, and I'm going to stay mostly in my lane. What I can tell you is that if you have TriCare for Life, then you've already got Medicare A and Medicare B. And I'm assuming, since you're asking this question, you also have us along with TriCare for Life. So you've got Medicare, FSBP, and TriCare. And we pay in that order, in that Medicare for medical will pay first, FSBP pays second, TriCare pays third. When it comes to prescription drugs, though, your FSBP benefits would be primary. And in this case, the Part D plan would be primary if you're enrolled in that. The PDP would be primary. So if you were enrolled in that, I can't speak to how it would affect anything with TriCare for Life, or if it would affect TriCare for Life. I can just tell you that the benefits you have under FSBP will pay prior to any benefits under TriCare for Life.
All right. And it looks like we've gotten some questions about will joining this new plan cause any delays in getting prescriptions or things like that? Can either of you guys attest to that or answer that question?
Yeah, I can speak to that one. Okay. So the way there's prescriptions processed today will still be in an expedited manner under the Express Scripts PDP. So if you're using home delivery, nothing will change. All of your active and current prescriptions that they have today, they will automatically be transferred behind the scenes. We've been working with the AFSPA team for months, getting everything set up. So when January 1st comes, those prescriptions that they have, they can log in or call member services and order them, and they'll be delivered in just as timely manner. Or they also have the option of getting them filled at their local retail pharmacies. One major difference I like to call out with this Medicare PDP plan versus what they have today, all of those 60,000 retail network pharmacies, they can get a 90-day supply from any of those, just as they do home delivery. It's just not isolated to those Walgreens or CVS pharmacies. They can go to all of those pharmacies that are in the network and get a 90 days. So it's, local independent pharmacies or grocery store chains, as long as they're in the network, they can get 90 days.
Going into infomercial mode, but TJ, are you saying lower out-of-pocket costs and a wider option, wider network of pharmacies for even 90-day and specialty drug fills?
Absolutely. Big savings, big flexibility, giving members a lot of choices to make decisions on their own as to what they like to do. We know people love to support local, so that's why that flexibility is there to give members a choice.
Love it. And that's also part of the business case, is a wider variety of options for members to get their fills closer to home.
All right. And I think we're going to circle back to some questions we still have about IRMA and, the penalty threshold. So it looks like we have a question from one of our members, and they have asked, how is the penalty threshold calculated? Is it an average of the 2 years? And then which 2 years for 2024?
Oh, nope. Great. So CMS, they look at it from 2 years back from this current year. So 2024 plan year, they're going to look at 2022 tax returns. In 2025, they'll look at 2023 tax returns and so on. So they look back the 2 years prior from the actual plan year from when it's going to start. And they look at your adjustable gross income. So it's really not an average of 2 years. It's your actual tax returns for 2022. So you can look at that and look at your adjustable gross income, and whether you're an individual tax filer or you're a married filer, and see if you fall within any of those limits for that additional charge that may be added to your premium.
All right. And a follow-up question to that is, it looks like someone has asked, the Express Scripts letter mentions the $5,030 to $8,000 thresholds, or the donut hole under Medicare Part D how will this be handled under AFSPA Medicare drug plan?
No, great question. So not to get too deep in the weeds, but just at a high level, just to go through some of the stages of Medicare. So Medicare has 4 benefit stages. You have a deductible, you have your initial coverage limit, you have your coverage gap, which some people refer to as the donut hole, and then there's your catastrophic changes. Every year, CMS, they put dollar thresholds as to how you move through those stages. One good benefit about the AFSPA Medicare PDP plan is they do not have a deductible. So from January 1st, you're automatically starting in that initial coverage stage, which is stage 2. Another good thing about the AFSPA benefit is there is no cover. There's no donut hole. They are given the same coverage in the coverage gap as they are in the initial coverage stage. One major component and difference in the Medicare PDP versus the FEHB benefit plan today is how those dollar that you're spending, as well as what AFSPA is spending, is counted towards this $8,000 catastrophic stage. So not only what you're paying, some of the money that AFSPA is paying is counting towards this $8,000. So I'd like to make a major point is no one is ever going to spend $8,000 out of their pocket. This is a combination of dollars you're spending as well as AFSPA. So to bring it all back together, just at an example, let's say you have a medication that the total cost is $1,000, right? Let's say it's a specialty medication and it costs $1,000. Your responsibility, the most you would pay is $150 for that, right? So you'll pay the $150. AFSPA is paying the remaining $850. So you have your total of $1,000. Well, under the Medicare PDP plan, that entire $1,000 will go towards your accumulator. Whereas today, how that would work, only the $150 that you actually spend out of your pocket would go through that accumulator. So that is how you can move through these benefit stages a lot faster under the Medicare PDP versus the FEHB plan that is set up and in place today. One major difference is starting in 2024, as Kyle mentioned earlier, one of the reasons for moving there is there's a lot of provisions for members in the Inflation Reduction Act that was signed last year. And one of those provisions is beginning in 2024, once members reach the catastrophic phase and hit that $8,000 threshold, they will have zero cost share for the remaining of the year. Which is an amazing benefit. So not only are the copays lower, not only does what you pay and AFSPA pay is counted towards your accumulator. Once you reach that $8,000 limit, you're not going to have any more costs for the remainder of the year. I know that was a lot. There may be some more follow-up questions to that. And if so, please put them in the chat because I understand this is a very important topic and people need to understand it thoroughly. So please send in more questions if you have them regarding this topic.
What it comes down to, though, is that we have set it up so that members will never pay more than out of their pocket for prescription drugs under the PDP. They will never pay more than $2,000 in a given year. That is how we've structured it. You may even pay less than that before it hits that catastrophic limit based on how much AFSPA is paying. The plan's paying toward that, but otherwise that has been carved out from the overall catastrophic max under the foreign service benefit plan. So that $5,000 annual catastrophic max for an individual enrollee for in-network, we're taking $2,000 of that, put it over here with the PDP. So even the medical is limited to now just $3,000 if you're enrolled in the PDP. So with cost savings for members, that was the main underlying, the main impetus for us going to this plan, and excited to see the savings for members.
Absolutely, and it is approaching 11:30, and TJ has been incredibly helpful in answering a lot of these questions about PDP, and he will be leaving us shortly. But that does not mean AFSPA Live is ending. Kyle and I will still be here to answer any questions that you still have about PDP or open season in general, because it is still open season. If you have further questions and want some more answers, you can obviously go to AFSPA.org/PDP. You'll find all kinds of links there. Kyle also did a podcast with TJ, and that you can find that at AFSPA Talks on any streaming platform or our website as well. And there's also still open season webinars going on. Those are going on almost every couple of days, and Kyle will be there to answer any further questions you may have. So we just want to say thank you so much to TJ. You've been incredible, and it was great having you here, and we'll continue on after TJ leaves.
Thank you. Thank you guys for having me. Great questions, great engagement, and I was glad to be here.
Thanks so much.
Have a great day.
You too. Thank you, TJ. All right. And I know that we've gotten a lot of questions from members about what are the downsides if someone were to opt out of this, or why would one choose to opt out if the high income situation doesn't apply?
So, and I think that is the main reason that people would choose to opt out, and why people are choosing to opt out. We've had about 1,000 people who opted out of this program to date, maybe more than that as of today. But they looked at it and they decided that based on the medications that they're taking, and they may only be on 1 or 2 medications, and maybe they're generics, and they're weighing the cost savings there against perhaps the IRMA that they might be paying. And keep in mind, the IRMA is an individual amount. So if we're talking about spouses, both of whom would qualify for the PDP, we could be talking about doubling that amount each month. It is an individual amount. They may weigh that and say, actually, you know what, the cost of the IRMA outweighs the savings that I would see. Excuse me. The other reason might be if people regularly travel and perhaps receive medical care or receive prescriptions outside the United States. TJ talked about what that process looks like before, but they may wish to retain the benefits that they have now under the Foreign Service Benefit Plan. So those are really the 2 main reasons people are looking at and considering and taking action to opt out.
Absolutely. And I do want to reiterate too that obviously we send out a form asking for questions to be sent in. But if your question does have any information that includes your personal health information, we cannot ask that online or on air. But if you would like your question answered, you can absolutely email us at outreach@afspa.org or call our number that we have, and we will do our best to get that question answered for you. Here's our phone number as well. And Kyle, go ahead.
Yeah, I just wanted to note that, this is a busy time of year for us. So we do have our team working hard and working extra hours to answer general inquiries that come in. But this is our busiest time of year. So they typically, we're getting back to people within 3 days. That may be a little bit longer this time of year. So we appreciate your patience.
All right. And it looks like we have a question about prior approval again. Someone has asked, please explain under what circumstances prior approval is required under this plan versus the current FSBP plan, with an example of a drug that does not require prior approval now, but would under the new plan.
Sure. And I can't do the last part. I do not have a specific example, and I also do not have a specific list of the drugs that require prior approval under the Medicare Advantage plan, and that list changes. What I can tell you is that there are drugs under the Medicare Part D plan that do require prior approval. It is a slightly different list, and that list is actually determined by CMS, the Center for Medicare and Medicaid Services. So that is determined and goes by them and goes into the Part D plan. So it is different than the list. And so some drugs that require it now would continue to require it under the Part D plan. Some drugs that require it now under the high option would no longer require it. And there may be instances where there is, and I think this would be rare, where it's not required by the high option benefits, but then would be required under the PDP. I think that's less likely. I think in most cases, if Medicare is requiring prior approval, we're already requiring prior approval as well.
All right. And we just want to reiterate again, too, that if you opt out now, but later opt in, there is no penalty to do that. We know that's a question that we've gotten quite a bit. and it's completely understandable to know, and you don't have to wait around for open season at all. And we do have a question about, will this video be recorded for future viewing? Yes, all of our AFSPA Lives you can find on our YouTube page at AFSPA Cares. You can watch any of those. They're all up there, and this one should be available right after we end the show. And you can also, once again, view our podcast that Kyle and TJ did that went into great detail about PDP, and also find out more information at aspa.org/PDP.
Yeah. And I just want to clarify, because I saw a comment come in just now. Yes, in a prior webinar, we did have the person from Express Scripts did say incorrectly that if you declined, you'd have to wait for another open season. That was incorrect. We sent out a clarification email to people who had registered prior to the webinar. I think some people have registered and gone in and watched the recording after that, may not have caught those people. But no, you can, as Maddie said, you can what we'll say is opt back in, re-enroll at any time. The same thing is true as if you remain enrolled now, it turns out you don't like it, doesn't work for you, you can you can disenroll from the plan in the future. It is not an immediate effect. If, for instance, if you contact us on April 15th, to re-enroll or to disenroll, that would not become effective until May 1st. That's just how Medicare works from month to month. Just like retirees' annuities work month to month, the Medicare works month to month. So that there would be a slight delay there, but it would be effective the next month. So I hope that is helpful information and addresses a number of the questions I've seen coming through.
Absolutely. And Kyle, I know that we've had a few questions about, sorry for how my blinds are looking. I'm being blinded by the sun currently. But we've had some questions about, I've lost my train of thought. I'm so sorry, guys. Are there, let's see, what is the difference? I'm trying to make sure we're answering all of the emailed questions that we got handled in. I know that we've talked a lot about catastrophic and emergency things, but just want to reiterate, is there any difference between catastrophic medicines, how they're handled in the FSBP now versus how they'll be handled in the new PDP plan?
Catastrophic medicines? I'm not sure, and I think Maddie's gone to fix her angelic glow coming through the blinds. But I'm not sure what's meant by catastrophic medicines. We talked before about the catastrophic cap. I also just want to note that drugs that are covered, there was a question about this as well. Maybe this is what someone's referring to. There are drugs under Medicare that are covered under Part B as in boy, that are considered medical benefits. So these are drugs that maybe you go to your doctor's office, the hospital, an infusion center to receive. Those will still be covered under Part B. They have been designated by Medicare as Part B drugs. This will not this PDP plan will not change that. And I'm seeing a message here that chemos may be catastrophic, reach the limit. We talked about what the limit is with chemo. That potentially could be covered under the Part B, depending on how you're receiving it. Under our current FSBP, for people who don't have Medicare, there are options to receive the infusions at home and so forth, but this does not affect that. We have a $2,000 out-of-pocket maximum. You will not pay more than $2,000 for prescription drugs in a given year. And it may even be less than that when you hit the overall accumulator, as TJ talked about before. I know it was complicated, at least it was for me. And this is the third time I've heard it. But it comes down to, you will not pay more than $2,000 out of pocket for any prescription drugs under the PDP.
Absolutely. And I do want to hit again on the email that people should be expecting if they've opted out. What does that email confirmation look like? Who does it come from? And what would the subject line be for people to be able to search, Kyle?
Sure. And I apologize, I don't have the subject line in front of me, and I should. And that's why I'm looking off to the side. It will contain information, and I believe it includes a PDF attachment is what you're looking for. And it includes a confirmation number both at the top and at the bottom of that PDF. The confirmation is 9 digits, a dash, and then 7 digits, very long number there. And then it will include in the middle, the part that will stick out to you will say waived opt out. That is, as we said before, has been confusing to some people. That is your confirmation that you have waived coverage, that you have opted out of coverage. We are changing the language going forward, but that is what you're looking for. Is a PDF attachment that would say that, include that information.
All right. And it looks like if you have a question that you want answered about the PDP plan or about open season, please send those in right now so we can be sure to answer those before we end our live today. And Kyle, would you like to talk a little bit about all the things we have going on for open season and before open season ends?
Yes, absolutely. So we've actually had teams out visiting, I think, 6 different countries already, doing in-person briefings. We've been delighted to meet with members in person, some of them for the first time in 4 years. To the folks in Japan who probably are not joining us for this broadcast right now, but we got back to some countries we hadn't been in a while. We also have some live webinars that are coming up, including one at 10 p.m. Eastern time tonight. I'll be there. It is a video going over all the open season changes, discussing that, and then live Q&A after that. We also have some at 5 a.m. Eastern next week, as well as some in the afternoons, including one at 3 p.m. next Friday. That'll be our very last one. We are also participating in the virtual benefits fair sponsored by Long-Term Care Partners. That is a separate login. There's some live chat days that I think one may be happening today.
It is.
Absolutely. Some happening today, and we've got another one next week, I believe. And we've got folks dedicated to answering questions in that virtual benefits fair as well. So I encourage you to look for that. You can also catch our podcast that we did on the very first day of open season. So back on November 13th. And Maddie and I went through all the open season changes. And that coming this next Monday, on the 4th, we'll actually have a frequently asked questions podcast on open season that we'll be recording tomorrow with some of the folks who've been out traveling and talking with members in person. So don't miss that if you have any questions. But please also keep in mind that open season ends on December 11th. So any changes you want to make to your health plan, moving from one plan to another, or self plus one to family enrollment, or family to self only, etc. All of those are that is when you do that. Also with the FedVIP program, and also with the FSA Feds program for active employees. So take a look at those programs. Join us or catch the podcast recording.
All right. And before we hop in, we're going to reiterate some income threshold questions and opting in and opting out. We do have a question from someone asking about that they have Medicare A and B. They don't have Medicare Part D plan and currently pay $15 for a 90-day supply of generic drugs. If they opt out of the Part D plan, will this still be my cost, or will the copay increase if I opt out of the new plan?
That's a great question. And the answer is we are not changing the benefits under the high option plan. So we will still have a $15 copay for a 90-day supply of generic drugs in 2024. That is not changing. So if you opt out of Medicare Part D, the benefits under the high option plan remain the same. The cost share remains the same. So that $15 for the 90-day supply remains the same. It still does have to be obtained maintenance medications through home delivery or through a participating Smart 90 pharmacy, which is pretty much Walgreens or CVS, a handful of independent pharmacies in places where there isn't a Walgreens or CVS, but typically those 2 retail chains or through home delivery. That's a great question.
All right. And someone's asked, if I only have Medicare Part A and the FSBP plan, will I pay an additional premium?
So there is no additional premium for this. Based on your income, you may be facing an income-related monthly adjustment amount. And we were able to talk about this a little bit earlier. I'd ask my magic makers in the background if we can get that income slide up again. There we go. There it is. So here you can see these are the amounts for 2024 It is based on your modified adjusted gross income from the 2022 tax year. So you can find your filing type, whether individual, joint, or married filing separately. You can find your income on there. And then on the far right column, that tells you how much more per month you would pay in those income bands. So that there's no additional premium. The base benefits, and for anybody under $103,000 individual or 206 joint filing, pays nothing more. There's no additional premium, but you may face that IRMA if you have an income above those thresholds. And that is a monthly amount, and that is an individual amount.
All right. Going back to some of our social questions, Kyle, can you let us know some more questions or some more information about the last day to opt out, and can you opt back in if you want to, if you've already opted out, etc.?
Yeah, so technically speaking, there is no last day to opt out. You can opt out or disenroll from the program at any time. However, you're talking about that you want to opt out prior to the program going into effect on January 1st. I recommend doing that as soon as possible. Again, there is no last day, but there is a lag time when we get the information and then have to communicate it and get it over to Express Scripts for processing. So I recommend doing that. If you haven't opted out before now and you think that you may still receive the enrollment packet, including a new ID card. However, if you've opted out, gotten that confirmation, then you can ignore that. But I just want to note that at this point, those packets are in production and may be reaching you soon. Excuse me. And so you can ignore that if you've opted out and received the confirmation that you've opted out. But there technically is no last day. But if you wait until January 2nd to opt out, you'll have the PDP for the month of January, returning to the PDP, to the high option benefits come February 1st.
All right. All right. And we have a question from YouTube asking, how will Express Scripts get involved in Part B chemo infused at a cancer center? Are there separate approvals for chemo drugs and the in-network center?
Okay. So if you're going to, and I'm going to answer this theoretically with a lot of ifs, because it's going to depend on individual situations, but it sounds like you're going to an in-network. The question is, if you go to an in-network center and you receive an infusion of chemotherapy drugs there, how does this affect that? I think a little bit of that will depend on how the drug is obtained. If you have Medicare Part B, my understanding, and this is my understanding, so please do not take it to the bank, and I'm going off the top of my head a little bit here. My understanding is that Part B will cover the infusion services as well as the drug, because the infusion center is ordering the drug. Please do not hold me to that. I'd welcome you to email me, and I'd be happy to get an answer on that for you, or email the outreach box. We can get that answered. That's where I want to stop. I don't want to go too far and say something that may end up being incorrect. I'd like to get you a verified answer on that.
All right. And it looks like we may have some voicemail questions. And I think someone in the background will put those on if we want to answer them. Potentially wait for further notice, but we will ask a question about, someone called in and asked about, my question is, with the new Medicare prescription drug plan, Express Scripts, does that change the fact that if you need a prescription for less than 30 days, you go to the doctor and you need an antibiotic or you need a steroid, etc., and yet it would only be for maybe 5 days, maybe 10 days? How does that affect this?
Your coverage now is under the PDP. So You can go to any farm. You go. This is an acute need, as it being described: antibiotics, steroids, something like that, for a short amount of time. Get the script from the doctor, or they can send it to your preferred local pharmacy. As long as that pharmacy participates in the Medicare Part D, the prescription drug plan network that we have, which is most, as TJ said earlier, most national pharmacies, even a lot of local pharmacies. The only exception are those Kroger family of stores pharmacies. So there was a specific question earlier about Harris Teeter. Harris Teeter is owned by Kroger. Harris Teeter pharmacies are not in network now. They would not be in network under the PDP, but you can go have the doctor send it there. It would be filled depending on where it falls in the tiers. A medication, if it's a generic, then you're looking at $2 for that up to a 30-day supply.
All right. And it looks like we got another question asking about donut holes. From what was said, is it correct that we pay more for the donut hole through high option than we would with the PDP plan?
So the high option plan does not have a donut hole. The donut hole was a term that came out with Medicare Part D, and that gap in coverage between when you hit a certain amount and we shared the amounts earlier, and before you hit the catastrophic maximum of, I believe it's $8,000, where there wasn't coverage under Part D. No gap in coverage under the PDP. There's also no gap in coverage under FSBP. So under the high option, we have an out-of-pocket catastrophic max total for medical and prescription of $5,000 for the self-only enrollment for in-network services, $7,000 for family in-network services. The other under the PDP, we're carving out $2,000 of that $5,000, putting it over here just for prescriptions. So your medical out-of-pocket becomes that $3,000 max, prescription $2,000. We're sort of separating the two under the PDP. So I hope that answers the question. But the high option plan isn't a Medicare Part D plan, so there is no donut hole. There is no gap in coverage. The PDP also does not have a gap in coverage. You are very well covered under both options. You just have lower out-of-pocket costs under the PDP.
All right. And it looks like we have a voicemail we want to play about controlled substances. So hopefully that will play next.
So my question is this: if I opt out, can I?
Another question is on the prescription drug medication. How is it going to work with medication that's considered a controlled substance and given on a 30-day basis? What will be will there be timeliness in getting the medication? And will this medication be available through that program? And thirdly, what are there any penalties for opting out of the Express Script program? Thank you very much.
All right, I think I can answer all of this. I'm going to begin at the end. No penalties for opting out. No changes in the benefits as you come to know them under the high option. We're not making any changes to that next year, so no penalty. When it comes to they mentioned controlled substances, I'm going to answer generically about drugs that are received on a 30-day basis, or as we said before, acute. As long as it's been available under the high option, the FSBP high option benefits, this PDP plan is providing, it includes wraparound care is what we're calling it. So if there is a drug that's available now under FSBP, but it's not a Medicare approved drug, one that comes immediately to mind, one category are the weight loss drugs. So Wegovy, Zepbound that was recently approved, that are specifically approved for weight loss. Weight loss drugs are not covered by Medicare Part D. It would require, I believe, an act of Congress to change that, but they are covered by FSBP. So we're providing wraparound coverage, so you still have access to those. So if you've had access now, you'll continue to have access under the PDP. It's worth using that search tool that you can access from AFSPA.org/PDP. Just click on the first link on the right-hand side. That's FSBP-Express Scripts Medicare prescription drug plan. It'll take you to a place where you can search for drugs that will tell us what It will tell you what your drug will cost and any coverage limits. So for instance, if it's only available at 30 days, not available at 90 days, it will include that information there and also tell you what your out-of-pocket costs will be when you obtain it.
All right. And I know, Kyle, we covered this a little bit earlier, but it is a great question. People are asking, how is FSBP able to offer this Part D coverage to us at no additional cost to members?
See, I thought that was because of you and your angelic glow earlier that you made that happen through magic. No, actually what it is that we are enrolling members who will be in the PDP. We're enrolling you in a prescription drug plan, a Medicare Part D prescription drug plan offered through Express Scripts. And so what we're actually doing is transferring the risk to that Part D plan. FSBP, therefore, is paying an amount to Express Scripts for them to manage those members, to manage the prescription needs of those members who are in the PDP. So we're transferring the risk, and because of that, the amount that is included in the premiums that's been factored in for prescription drugs goes in from the actuarial tables and everything like that. They even use tables anymore, but it's all been factored in so that we can offer this at no cost. Members may have to pay that IRMA, as mentioned before, but it is based on that option. So the same theory that we were able to offer the Medicare Advantage plan at no cost to members. We're transferring the risk to another Medicare managed plan.
All right. And just reiterating, we have a question about if they don't have Part B, how does this new PDP affect them?
Sure. So if you do not have Medicare Part B, but you do, I'm going to assume here that you do have Medicare Part A, which is the hospital insurance usually available at no cost. You have to have one of the two. You can have both, but if you just have Medicare Part A, you are still eligible for this program and you will be auto-enrolled. So if you do not want to be in the PDP, you will have to take option to opt out. Your enrollment in Medicare Part B does not necessarily impact your eligibility for this program. If you're in A, then you are eligible for and will be auto-enrolled in this program.
All right. It is coming up on noon, and it looks like we've answered most of our questions, if not all. And just a reminder to everyone, if you submitted a question or you still have more questions, it probably was covered earlier in this live stream. And this live stream will be available to you on our YouTube page at AFSPA Cares immediately after we end the show. And you can obviously as well go to our podcast to listen to the PDP podcast episode we did with TJ from Express Scripts. If you have any further questions, please reach out to us either by calling us or by emailing us outreach@aspa.org. And just a reminder, open season is still going on. It will be going on until December 8th.
December 11th. You actually get that
so
one extra day.
I know. I was like, wait.
Yep.
And so don't forget about that. Don't forget that we are having webinars that Kyle is hosting for you all throughout the day so that there's times for everyone. And if you still have further questions, you know how to reach us. And this has been lovely. Happy open season. And we hope we've answered all your questions.
Yeah. Thank you, everybody. I'm delighted about the level of engagement we've had today. And again, hope we have answered your questions. If you're an early riser, join me at 5 a.m. on a couple days next week. If you stay up late, we'll be going till after 11 tonight. I will be off camera for most of that. It's a video, thankfully. So thank you, everybody. And we'll see you again in December. Watch your email. We may do a modified date because of the holidays, but we'll see you again in December and then in the new year.
Thanks for watching our broadcast. Join us again the last Thursday of every month at 11 a.m. Eastern. Also, don't forget to look for AFSPA Cares on all of our social media channels: YouTube, Instagram, Facebook, and LinkedIn.